The Uganda was calling AIDS a slim disease. So a lot of patients will come to the doctor when they lose weight. Tanzanians were calling it Juliana, and Kenya we were calling it Musada. It was called slim disease because people who used to have HIV and AIDS were suffering from loss of weight. Sometimes people wonder how Dr. Willia or other dermatologists were interested in HIV and AIDS. Initially, the AIDS clinical manifestations were presenting on the skin. And so the dermatologists were the first people to observe clinical changes in the skin. These are the swellings on the legs, the face, and the parts of the body. The first patient I saw, which was in 1984, presented with these features of swelling on the body. Unfortunately, at that time, the tests were not being done here in Africa, not in Kenya. They were being taken in the United States. They were doing these tests. It used to take about something like a month before the results come back. But it came back to be positive for HIV. That was my first patient, and I think it's the first patient that we saw in Kenya. After that, I saw nearly 5, 10, 20. I was the one in charge of the records by then, the only one initially. In 1984, 1985, I was the one who was holding the records of case of HIV in the whole country. I attended so many meetings on HIV and AIDS. For example, when we were in Italy, when we were forming the African Association of HIV, we went to Italy. There used to be an editor of Standard called Arnold. He just met me, not me, but other African delegates, and they asked whether we have HIV in Kenya. And I say, yes, I'm suspecting some few cases I've seen, but as journalists always like to exaggerate things, he had put this on the headline, that Dr. Willie says that there are cases of HIV in Kenya. And as usual, when there's such a thing, the Minister of Health or the government would like somebody just go to the press and say we have this in Kenya without actually being following the right channel. So the Minister of Health and the Director of Medical Services, the late Dr. Konange, called me and said, what is this thing we are seeing in the newspaper? I said, Arnold interviewed me and I told him this. And he said, no, you shouldn't have done that. I was shocked because as a scientist, I thought I would really air my opinions. They don't do enough at all. There's nothing was going on. Instead, there was a denial that we don't have the disease in our country. Each African government was saying, we don't have it in our country. We have not seen any patient having HIV. We have not seen anybody dying of HIV. This is a propaganda. So the government did not have any policy at all on HIV/AIDS. The medical people were not actually keen, and frankly speaking, they were even scared, as you asked me, to handle cases of HIV. Some hospitals were even not happy to admit a patient with HIV because they thought that such a patient should be isolated, and they didn't have isolation rooms. Some companies would not accept anybody with HIV to work in their company, even if they're just sweepers or just, they will not. Why? Because they didn't have the knowledge And because of that, HIV spread very, very fast in the Africa, especially in Kenya. Those who have HIV did not want to accept that they had a disease. So if I had the same knowledge by now, I would have actually trained many health workers that would go around the country, educate the people about the HIV so that we can prevent the disease. That once you have the disease, you are tested, you can actually stop spreading it to other people. Definitely there's a lot of change in terms of treatment, because initially there was no treatment for HIV. First few patients died, there was nothing to treat them with. The scientists had not found a drug that would cure HIV or prevent HIV. There were quacks who claimed that they can treat HIV because they were getting a lot of money. People were scared of HIV. When they have HIV, they would go to any treatment. First of all, we started with what was called MM1. I don't know if you heard about that. That is a herbal medicine that was, found by someone from Zaire. I was sent to Zaire by the government to go and find out this MM1. And I found 4 Kenyans there who went there for treatment. One died when I was still there, so it wasn't really effective. Then came what we call Cameron, which was well known, done by our colleagues. Cameron was thought to be quite effective in the treatment of HIV, and a few scientists say, well, now we got it. Well, it never worked. It was supposed to boost up the immune system, but it was not a cure. Then Nobel came with Palomega and others, which trying to convince the people that, well, now we got the best one. It's never worked. And somebody somewhere, Amzungu, I think is the one on my magazine, who came and said that you can pull out the virus from the body, check out the virus from the body using some machines. And that never worked. So a lot of things, somebody in Kampala was actually dissolving soil in water and putting vitamins and putting honeys, and told the patient that this can treat can treat HIV. And so many people went to Uganda for that. Spent a lot of money. There was no cure. I happened to be with very known scientists who are doing research on HIV and AIDS. These were the people who started doing a lot of research at that time. And these people did a lot of research. But that time, most of the research was more of preventive. You see what I mean? Preventive and educative rather than purely scientific research to prevent the virus from attacking the T4 lymphocytes. So most of the people who are doing research were from Europe mainly. So the manpower was the main challenge, finance and manpower. Because you need people who are well trained, who are dedicated to do research. Things have improved very much, and the campaign against HIV has been tremendous, and I must actually give them credit for that. From 1984 up to now, a lot has been done. Me, I know because I started it, and I'm still seeing what's going on. The same thing that has been going on should be intensified. One, the health education. People should be aware of the disease. People should be encouraged that this disease now, if you're taking the drugs, we have no problem. So all those who are positive should now attend various clinics where they give free treatment. That wasn't there before. Initially, when the HIV drugs came, they were costing about 60,000 shillings a month, 60. Now they are costing about 3,000, 4,000. And in government institutions and others, they're free of charge. It's a big difference. My dream is that we should prevent the spread of HIV. We should actually educate the people so that children being born from mothers having HIV should not have HIV, so that we know how we can prevent mother-to-child transmission